my boss, a woman who I loved and still love, who was trying to protect me, said, listen, now that you're pregnant, everyone's excited for you, but when you're asked, like, can you come in at midnight? Can you go on this debate? Can you travel? If you can't do it, don't say it's for childcare reasons. Make up something else. You're sick, your husband, whatever, this, but don't make it for childcare because they'll stop giving you opportunities. They'll think, oh, she's a mom now and she can't work. And I said, oh, thank you for the advice. That's so great. And then I thought about it. I didn't make up that system. The first thing I'm going to do, the first chance I get, I'm going to rip this Band-Aid off and say, childcare reasons, I can't come in at midnight tonight.
Yeah.
And I did it. And I was in a position to do it, right? I wasn't like just starting. I was established, so I could do it. Nothing happened.
This is Dr. Chethan Sathya. Thank you for joining us for this episode of Northwell Health's 20-Minute Health Talk. Today I have colleague and friend, CNN's Cupp here with me today. Thank you so much for being with me.
My pleasure. Thanks for having me.
Yeah, it doesn't feel like that long ago since we were at South by Southwest together.
Was it last year or 2 years ago?
I think 2 years ago.
Okay. Yeah. It doesn't. That wasn't a fun time for me. I really enjoyed our talk.
Yes.
But candidly, I was having an anxiety panic attack during that time. And maybe because you were a doctor or maybe because you were the only person I knew immediately in front of me, I was like, I need your help.
Yeah.
I am spiraling. And you were so kind and you walked me around and you were like, let's demystify this. I know it's a lot of crowds, but let's walk around. We can calm down. And you really did. It was great.
Oh, I mean, listen, it's likewise, I had a lot of the same feelings. And the panel, I will say, was focused on gun violence.
It was, yeah.
And you moderated it exceptionally well. And I think your perspective, being a center-right kind of commentator and expert across journalism.
And gun owner.
And gun owner was huge.
Thanks.
Was huge. So I gained
it's an important issue.
Yeah, I gained a ton from that experience.
Oh, good.
So you're doing some incredible work at CNN with your own podcast to try to bridge divides. And I've watched your journey with fascination, over the last 5-6 years. Take me back to a moment, actually. I've always wanted to ask you this. When did you start to say to yourself, hey, listen, when it comes to the conservative movement, I'm starting to disagree with things here. But was there a pivotal moment that kind of sticks with you where that started to shift?
Well, I disagreed early. Even when I was Team Republican, there were things that didn't jibe to me. I had long been an advocate for gay rights. That was not the case. By the way, that wasn't the case in the Democratic Party 25 years ago either. I was sort of ahead of that on both parties. And I would challenge my party all the time, whether it was through like log cabin Republicans or Go Proud on their stance on gay marriage and gay rights. I also didn't believe in capital punishment. I didn't think that was conservative. I broke with my party there. And I'm an atheist. So for a political movement that grew up with the religious right, I was sort of an outsider. As much as I supported and believed in a lot of conservative orthodoxy, from lower taxes, strong national defense, anti-regulation, normal stuff, okay? Normal stuff.
Yeah.
Back when there were normal things. Anti-protectionism, for example. I was still on the outside a bit. But I was very much Team Republican because Team Republican was the team advocating and espousing conservatism. When they stopped doing that, which was very quickly in 2016, well, I stopped being a Republican because I wasn't there for the Republican. I was there for the conservatism, the philosophy, the principles. When Trump decided he didn't care about the principles, no longer cared about the debt and the deficit, didn't care about tariffs. They were fine now. Family values, what? Right? National defense, taxes, like none of it mattered to him. And so it didn't matter to the party.
Yeah.
Well, that's when I broke. I'm still a conservative, more conservative than anyone I see in the Trump administration or, to a larger extent in even Republican Congress. But I'm certainly not a Republican. I wasn't going to walk down that road. But even putting aside like just how morally abhorrent he is, Trump, and is really not my kind of politician, just the policy, the principles were gone. So I had no reason to be there.
Okay, so you've been trying to bring together, let's say, diverse voices on both sides of the aisle.
Yeah.
Right. And public health, when it comes to public health and healthcare, I mean, things are no different when it comes to polarization right now.
Right.
Right. But it's easy to feel hopeless.
It
where
is.
you're like, hey, like, how do I actually bridge that divide? So I'm just curious, what lessons have you learned and what works and what doesn't?
I think the media can certainly make you think that you must be on this far extreme of an issue or this far extreme of an issue to be counted. And in fact, like you said, the majority of us are in the middle on like every issue. Name your hot button issue, from abortion to climate to guns. Most people are in the middle.
Yeah.
We don't feel like we have representation, though, either in the media or in politics, because our voices aren't the ones being amplified. It's the far left, far right. And with the closed primary system, you're really only attracting the far left and far right candidates and voters who want to come out in the midterms and vote for far left, far right candidates. It's really missing the biggest chunk of American voters, the moderate middle. Yeah. And so we feel like orphans. How is a majority so lonely, so unheard and unseen? We're just not being catered to or spoken to or governed for. And I think that's such a huge frustration for most voters, that they just feel left out of the political conversation. And whatever side of it they're on, they're just watching total dysfunction and the buck being passed back and forth, constantly back and forth, whether it's from the previous administration to the next administration, that administration blaming the previous administration, or it's being passed back and forth from Republicans to Democrats. It just feels so dysfunctional, and that creates that feeling of hopelessness. Like, well, what can I do? I'm outside of the system. No one's even looking at me or counting me as part of this conversation. Yet I'm in the majority, and the majority of all the things you guys are doing affect me the most. It's awful. It's a real dereliction of duty, both I think in the media and politics.
Well said. And I think it's so interesting because in public health, if you look back at some of the messaging we had, and for example during COVID-19, I mean, it was a tough time right here in New York. You were in New York. People were scared. We were scared. Yeah. I think there were a lot of things that we were trying to do in good faith, but it came a point also where I think we, and when I say we, I mean many folks, kind of stopped listening, right, to people in the community. Like, what is it that they're actually suffering from? What is it they actually care about? I often think about the small businesses that were closed during COVID-19.
Right.
And we were talking about lockdowns, but were we really thinking about those individuals and they needed and what they were suffering with? Yep. We had a job, right, in the hospitals at the time. And so I think it takes listening to kind of transcend some of that. But with traditional media, things are changing, right? People are consuming their information, whether it be regular news, politics, or healthcare, not just from traditional media like CNN, but from social media and other sources. So what are some solutions that you've found that could work or that you're trying to work on to kind of talk to that majority of Americans, that silent majority?
Yeah, I mean, you have to find people where they're at, and people are watching cable news less and less. Yeah. We're very aware of that, right? And that's why we're all trying to future-proof with streaming and, understand the cord cutting. And so you have to find people on social media, on TikTok. I started doing TikToks maybe 2 years ago. Podcasts, are a way of reaching people. And Substack is a great community that I found as well, even though I'm still inside of legacy media, both at CNN and then I write for a newspaper at the New York Daily News. Going to like an independent platform where I can talk about things I wouldn't necessarily get the opportunity to talk about on CNN, right? And that can include gun control when gun control is not the main story, right? I want to talk about it now, but there isn't a peg to it for cable news, so they're not going to let me talk about it. Well, I can talk about it here on Substack. Finding those opportunities has been great. And the good news in the sort of like rejiggering of media right now is that there's so many places to go. The bad news is there's so many places to go. And without the standards of corporate media, for all the things you want to say about it, You don't have lawyers. You don't have editors. You don't have producers. People can go out, say things pretty authoritatively, and they sound true.
Yeah.
And then I'm stuck trying to fact check and undo and unreport and say, well, this is not totally true, or this is completely untrue, or here's why this person's saying it, because I just found they opened a business that it's going to help promote. Like, you have to do so much work now to sort of like pull apart all the news stories and really get to like what's true, who are the good actors, why are they doing this, what's their motivation. I mean, it takes your whole day, to fact check a fact or something one person posted. It's a lot of work, and it's especially a lot of work. That's my job, but it's especially a lot of work to ask a news consumer, an 18-year-old kid who's not going to do all that work. They're just going to see Tucker say it or whomever say it and then repeat it. That's why, it's gotten so dangerous.
Yeah.
And tricky.
A ton of work and so many layers to work through.
So many.
I've heard a few folks recently saying that AI is actually going to potentially help.
Could. Yeah. Yeah.
Is that a way to synthesize that information in a more, efficient way?
I'm upbeat about AI.
Yeah.
Part of me is always a late adopter and a bit doom and gloom and a bit scared of new technology, but that's just me, my anxiety. But, I know enough about AI to be fairly optimistic about it, especially when it comes to healthcare. I think it's going to cure diseases before, we ever imagined we could, which is incredible to think about, right? But it's also going to present a lot of problems in news production. What's fake? What's disinformation? The upside, though, I think, is it's going to give us tools to become better reporters, producers, editors, and news consumers. Mm-hmm. And AI is going to start telling us this is fake. This is not real. I just checked the entire internet, cross-checked all these reference books. This is not true. Or here are examples of how this is not true, like in a much quicker way than I can do. So that's positive. But I think you still need, there's a human element to journalism that you'll never be able to escape. You'll never be able to replicate it with robots and computers. And we really need to hold on to the ethos of journalism, which is asking questions, being curious, holding powerful people accountable. Mm-hmm. Like, that's it.
Yeah.
That's the whole ball game. And, if we can all agree on the sort of best practices in that, then our community will remain vital and urgent and important. If we start disagreeing on how to do this, and we're already there, we're disagreeing on what is valuable, what is news, what counts as a source, this is when the problems happen, and this is when people start distrusting the media as an institution, and I totally understand why.
Mm-hmm. Yeah, so let's drill down a little bit on that. I mean, at its core, journalism is about storytelling and the human stories.
Okay.
Right? Or to some level.
Sure.
I mean, there's also the data, of course, and
it can
be
be
investigations.
The most important part of journalism, I'll say, is holding people accountable. That's it. Whether you're a small town reporter, holding your sanitation board accountable, this is what changes your life. Storytelling is important. And I write opinion. I'm on the op-ed side, right? That's an important part of it. Yeah. But the public service part of journalism is holding people accountable that you can't yourself. Whether that's in your local community, at your school, at your college, in your government, that is the vital job that journalism does. And we have research and data that shows when a newspaper shutters in a small town, corruption in that town goes up. This is real science to show just how vital, especially in small communities, local news and reporters are. That's number one tier job of journalists. Under that is storytelling and absolutely sharing stories from over there, right? I do a lot of reporting on Syria, telling the stories of the Syrian refugees so that Americans and Western audiences can understand them and relate to this group of people, or telling the story of this subculture, this small community. These are important things to do. I think that's like right under the holding powerful people accountable part.
Got it.
Yeah.
And I mean, if you look back historically, I mean, it was tons of investigative journalism that's held most people accountable in this country, right? Industries, the opioid industry.
Oh, I mean, just
beyond.
recent examples, if you look at Spotlight, right?
Yeah.
The Boston Globe and the Catholic priest scandal. If you look at Jerry Sandusky at Penn State, that story was broken by a local reporter named Sarah Ganim, who eventually came to CNN, but she started as a local reporter in Pennsylvania. The Epstein files, Julia K. Brown at the Miami Herald was running that story down for years before anyone would publish it or listen to her. She broke that story. The Flint water crisis, local news broke that story. These stories have a way of becoming international news, national news, but they can start at the local level. And this is where they're most important, when they're actually affecting your daily life.
Yeah.
It feels sometimes like cable news and the talking heads on cable news in Washington have the biggest stories. The stuff I talk about at night on CNN is important. Is it changing your life in Wichita? Maybe not.
Yeah.
Maybe not. So the local news, the small news, the local reporters, these are the people really impacting your life. And I wish they got a lot more oxygen, resources, et cetera.
And that's a major concern, right?
Huge.
The resources. I mean,
Huge.
So they also carry the trust of a lot of these communities, the majority of communities,
Yep.
right? The local ones.
Yeah.
I mean, more so maybe than
Definitely.
larger national outlets.
Definitely.
So what's going to happen there? Because we're hearing every week about local news being shut down.
Yeah, it's really disheartening.
Yeah.
Well, I've been telling people like Tom Steyer, right?
Yeah.
Billionaire.
Yeah.
Starbucks.
Yeah.
Ran for president. Spent $100 million running for president. He's running for governor of California now. Who knows how much money he's spending on that?
Yeah.
I've been telling people like that, I understand your desire for public service, and that is commendable. But these vanity campaigns are not it. Go invest in local news.
Yes.
You want to do something for America, for democracy, to make this country better, to change someone's life. Go invest in local news. Don't spend $100 million on a presidential campaign and get like 5 minutes of airtime out of it. So the billionaire class, we can shit on the billionaire class if we want. I have seen a real drop in a desire to be good guys. And that's disheartening, especially when you have a billionaire running news organizations and not really caring about journalism or democracy. That's bad. But when I meet a billionaire who has an interest in civic change and public service, like Tom Steyer clearly does, Mike Bloomberg clearly does, I try to take that opportunity to say, please put your money into better things. I've said that to Mark Cuban too. I love Cuban. I know you had him on. I love him, and he's so smart, especially what he's doing on healthcare and college education. He's got some great ideas. I wish he would invest more in local news because he's really smart, and I know he cares.
It's so powerful. Yeah, we had Mark on yesterday, and he was even making the same comments around investment in healthcare. Medical school, for example. He had brought up that all medical schools should be free. And it would cost, for example, the government $6 billion just to cover that all. But if you think of it, it's nothing when you think about providing healthcare in rural communities and tying that back to service. But the same type of thing, I think there's so many opportunities for creative impact.
I agree.
Across the board.
Yeah. We just have to think differently about it.
If you're going to recommend to people listening, the public, to go to one place to get their information. Is there one place?
I would never.
You would never?
No.
Where do you tell people to go to get information right now in a more balanced way?
Listen, it's tough, like we were saying. Ideally, you find outlets that have editorial standards, like double sourcing, right, is an editorial standard. We don't put things out at CNN without two sources backing them up. That's a standard. I require that when I'm gathering news myself. But there are lots of outlets, and I would challenge everyone to read more news that you think is the other side.
In recent conversations, I've been trying to bring together a lot of MAHA leadership, traditional public health, and again, both groups are not a monolith.
Right.
right? There are people that I have tons of agreement with, and there are people that I'm going to have to agree to disagree with
Yeah.
completely.
Yeah.
But you have to have the conversation to start. So drawing that line can sometimes be a little bit tough. And there's a lot of concerns in public health around platforming, maybe folks that are way out there.
Yeah.
How have you kind of navigated that? And has that evolved over time?
It has. It's very tricky. And I know we as a journalism community try to navigate that too, especially at CNN. Like, okay, we need to have a MAGA viewpoint represented. Mm-hmm. People need to know what that is. But do we put on liars? Do we put on people we know are going to lie on the air? How is that a public good?
Yeah.
That's a tough line just generally, ecumenically for journalism to walk. Personally, though, I can't always control who I'm put on with. Mm-hmm. But when I find out, I can say, I'm not coming on for that.
Yes.
And I do. My son's autistic, and I don't talk about it a ton because it's his story to tell. But they were going to put me on with some fitness guru who's an autism truther. Wow. And not only did I find that incredibly insensitive and like, oh, we're just lions and Catholics at the Coliseum. You're just throwing us in together. But I also thought, you are not going to use my good reputation to launder your bad one and to get credibility from me engaging with you. You're not going to get clicks off me. You're not going to get the legitimacy that I will lend to a conversation and that you will not. Mm-hmm. You're not stealing that from me. Mm-hmm. So that was just like a personal decision. And I have to make those all the time.
Every day.
What's good for me, what's not good for me, what's good for my community, whether that's the autism community or just my family. Like me going home at night and feeling like I did you right. That's up to me. And that has been an issue since like 2015, 2016. Who will I go on with?
Yeah.
Whose reputation will I wash for them?
Yeah.
Coming out of like a Trump administration and pretending now suddenly you're not one of them. Like, what are you talking about? You worked there for 4 years. You'd still be working there if he won.
Yeah.
Now you're gonna use journalism, you're gonna use CNN, to become credible again. I just don't want to participate in that. Mm-hmm. And actually, I've been given great leeway to make those decisions for myself.
That's amazing.
Which is great. But you have to ask for it. Yeah. And not everyone feels comfortable drawing that line, but I sure do.
Yeah.
Yeah.
Yeah. That's tough.
It's really tough.
Very tough because you in many of those situations probably have more to lose too, right?
Well, that's exactly the calculus.
Yeah.
I have everything to lose. They have everything to gain.
Yeah.
I don't like being in that position.
Yeah.
But I also, I'm not for censorship. So I would never be like, you can't put this person on. Mm-hmm. In fact, I want to hear from the crazies and the wackos. I want to know where they are and what they're thinking. That's important. We have to contextualize it. I think we owe our audiences disclaimers. We don't do that often enough. It's easier to do in print than it is to do in broadcast media, but, I try to do it. Mm-hmm. And I think it's kind of up to all of us individually, like how much are we willing to co-sign and participate in? And there's a lot of the media I want to participate in, and there's some I really don't. And I think because of my mental health journey and really figuring out like what is healthy for me mm-hmm. and what is going to make me feel really unhealthy, I've really had to examine those boundaries and just be very clear mm-hmm. about what I will and won't do. And if you don't want me because I have those boundaries, that is your right. And I totally get it. Yeah. That's your choice.
Yeah.
You don't have to hire me and pay me. But I also have some say in this mm-hmm. in this business. I'm not just a peg mm-hmm. that you can put into, a board. So I don't know. I've had to find that voice over the past 10 years or so, but it's been serving me well. And I think it serves my audience well too.
Absolutely. It's a really important lessons for many folks listening, because I know that there are people trying to have these conversations, and I think that's
Yeah.
a constant concern,
It
especially
is.
when you work for organizations as well, right? Because
Right.
reputationally, it's not just you.
That's
it's the
right.
organization you work with,
Right.
and there has to be some carefulness there. Organizations are concerned right now,
Absolutely.
under attack, and so
Yeah.
very, very important lessons.
Well, and not everyone, I understand, is allowed, has the liberty,
Yep.
the privilege to say, I don't want to do this. Fire me if you want, which is not what I say. That's not what I say. But, most people have to go to work and do their job.
Yeah.
And I'm sort of in a unique business where the job is varied. It's broad. It's expansive. There are a lot of things you can do inside of it. And there are things I will not do for money, period, full stop. So I think a lot of us are wrestling with that, but I understand not everyone can do that.
Mhm.
I understand not everyone has the ability to say, well, I'm walking out.
Yeah.
I get it.
Yeah.
I really do. But there are, I think, small ways where you can fight the fight that feel good to you. I'll give you one example that has nothing to do with politics. I came to CNN in 2013, and about a year later, I got pregnant.
Mhm.
And I had a show. I was on my own show. And my boss, a woman who I loved and still love, who was trying to protect me, said, listen, now that you're pregnant, everyone's excited for you, but when you're asked, like, can you come in at midnight? Can you come? Can you go on this debate? Can you travel? If you can't do it, don't say it's for childcare reasons. Make up something else. You're sick, your husband, whatever, this, but don't make it for childcare because they'll stop giving you opportunities. They'll think, oh, she's a mom now and she can't work. I said, oh, thank you for the advice. That's so great. And then I thought about it and I was like, fuck that.
Yeah.
I didn't make up that system. The first thing I'm going to do, the first chance I get,
You're gonna say
I'm going to rip this Band-Aid off and say childcare reasons I can't come in at midnight tonight.
amazing. Yeah.
And I did it. And I was in a position to do it, right? I wasn't like just starting. I was established so I could do it. Nothing happened. No one changed my career.
Mm-hmm.
I still got more shows. I got, moved up in my career. No one thought differently of me because I said the obvious thing, which is I'm a mom now.
Yeah.
And I can't always come in at 2 a.m. Or I got to go pump. I'm sorry.
Yeah.
Like, what a weird thing to hide that. Give some other excuse that doesn't really mean anything. So, I mean, those small victories, those small fights are actually huge.
Yeah.
And if you can find them, make the most of them.
I love that. We need to get you to speak to a group of surgeons.
Okay? No.
Because there are so many female surgeons that have struggled with, I've spoken to them,
Setting
have struggled-
those-
with
yeah.
setting those boundaries, right?
It's
Because
tough.
it's a male-dominated society
Yep.
as well, and
Yep.
certain expectations.
Oh, yeah.
And things are changing for sure, and I've seen that, but it's taken a lot of efforts. And
Yeah.
I think they would love to hear from you.
Oh, that's so interesting.
Yeah.
I can totally
that
see
point.
that.
Yeah,
I can
just having
totally see
courage.
that.
Do you think that we've made inroads now in being able to include some of those additional voices? What I mean by that is, right,
Maha voices? Like,
Maha voices,
okay.
or Dr. Bhattacharya, who wrote the Barrington Declaration during
Okay.
COVID-19,
Okay.
being against lockdowns, and
Okay.
talking about natural immunity, right? There was a
Mhm.
conversation there. There's a
mhm.
lot of grievance there around, hey, we weren't really
Yeah.
given a platform to be a part of the conversation.
Okay.
Do you think we've made inroads there? Because now these are the folks running the CDC and the
Right.
NIH.
Inroads.
Or is it just
Listen, they have a bigger voice.
yeah.
For better and worse, right? Not every skeptic is a conspiracy theorist. Skepticism is foundational to science, and it is to journalism too. We have to question and re-question and not take something at face value. That alone isn't a problem. It's when the conspiracy theory serves to promote a political point of view
Mm-hmm.
or appease a political group, and it's not based on anything real. It's just to feed an appetite for more of a political viewpoint. That's when it gets really dangerous. And the rise of conspiracy theories that I've watched in the past 20 years just covering news, it's so scary. And the way I talk about conspiracy theories is like they're a drug. They're a mind-altering substance. I have watched journalists I know go down rabbit holes. And they went from prestigious, well-respected, award-winning journalists to scraping the bottom of the barrel of like the Rothschilds and like Joseph Mengele and like nonsense stuff to talk about like Anthony Fauci, like crazy stuff, just to keep feeding a beast they created, right? Because with conspiracy theories, if you train someone to get addicted to them, there's no up, there's only further down. There's no, well, let's get them back up to the ground level above the conspiracy. There's only further and further down. So you have to keep feeding this beast. And people who traffic in conspiracy theories like Candace Owens and Tucker Carlson and Lara Logan, they know this. They know they have to keep doing more and more and more. That's why it's so insipid and hard to combat.
It's like a vicious cycle.
It's spiral down, down and down and down. And as news producers of news, it's really tough to combat that. Once people are into it, it's like you've lost them. It's like they're in a cult.
Yeah, there's almost.
And you can't break them out. They don't want to be broken out. They don't want to see reality or facts or truth. They really don't. And in fact, putting it in their faces like entrenches them more. So it's really tough to live and work in that kind of ecosystem. It's really tough. So, inroads with those people, again, it's great to listen to alternative voices when they are backed by some kind of evidentiary support and exercise. But every conspiracy theorist is not an alternative source. They're just a quack. Yeah.
And I like the distinction, skeptic versus conspiracy theorist, right? So a lot of the individuals I was talking about, I mean, I put them more in the skeptic
side. Yeah.
Right. And I think alternate theories.
Yeah.
Maybe the evidence doesn't
not
stack
for
up
fun.
Not for fun.
Not for politics.
No.
But because there are alternate theories, because maybe there's some evidence over here, or this data might be a little unclear, or we haven't tested this in 40 years. Let's do it again. Absolutely, there's room for that. And that should not be just shut down. But there are distinctions. And it's up to us and it's up to your community, both of our communities, to help make those distinctions
Absolutely.
clear.
And we have to get out there and have the conversations. I was part of a kind of MAHA-sponsored NIH roundtable with a lot of the NIH heads. And a lot of what's happening there is incredible. I wrote about this a little bit in the Washington Post, but some of the efficiency moves they're making in the NIH, like I totally agree with.
Oh, it's great.
Being an NIH reviewer myself, and there's a lot of redundancy there. There's good things happening, and it's kind of like,
that's great.
How do you embrace some of that, but then push back on the areas that you just say, we can't have happen.
And on the media side, what you don't want is a liberal outlet to hear that there's good news coming out of NIH, let's bury it.
Yes. That's
not helpful either.
Yes.
You need, and that really doesn't help with public trust. What helps is when you come out and say the unexpected thing. I've found in my career, as coming from the conservative side, and now I'm sort of independent, I guess. But even when I was firmly over on the right, when I'd criticize the right from inside, it had so much more of an impact than me just lobbing, missiles at the left, right? And now, I mean, whomever I criticize, because now I sort of just call balls and strikes, when I say the unexpected thing, that's when you lean in and you're like, oh, that's not what I thought she was going to say. Well, if a liberal leaning outlet, your favorite, comes out and says, here's some great things happening at NIH or CDC, you lean in. Oh, that's interesting. And then you've bought trust. Well, I know this person's going to tell me the truth, even if it's not in their political self-interest. That's what people need more of.
Yeah, because you're calling balls and strikes, just like you said. Right? You're not tethered to one side or another.
Right. You have to be able to see the point, to say, no, you're right. They got that wrong. We got that wrong. You have to be able to. In my business, when you want trust, you have to be able to do that.
And it takes a lot of courage, especially now. Right? It feels like, cancel culture is just still at an all-time high.
Oh, cancel culture is like baby stuff now.
Yeah.
Now it's death threats. Now it's who's going to swap me next, right? I mean, am I going to survive this? Cancel culture is terrible and corrosive, and I hated it, and I still hate it. But that feels like child's play. when we're getting actual death threats. The stakes are just so much higher now that we've had actual political assassinations.
It's crazy world we live in.
It sure is.
Essie, we're almost at time. One last question.
Okay.
If you're going to recommend to people listening, or the public, to go to one place to get their information, is there one place?
I would never.
You would never?
No.
Where do you tell people to go to get information right now in a more balanced
way? Listen, it's tough, like we were saying. Ideally, you find outlets that have editorial standards, like double sourcing, right, is an editorial standard. We don't put things out at CNN without two sources backing them up. That's a standard. I require that when I'm gathering news myself. But there are lots of, lots of outlets, and I would challenge everyone to read more news that you think is the other side. That doesn't mean you're going to agree with it, but take it in. Know what your neighbor thinks. And then maybe we have a little bit more to talk about. That's true on both sides of the aisle. And diversify your news experience in terms of, don't just get it all from cable news and television. Get it from a podcast who's going to talk to you over the course of an hour and maybe have more time to unpack a single issue than we do on cable news in 3 minutes. Find those longer form storytelling outlets, like a podcast, like a magazine outlet. Diversify the experience. Because if you're just watching cable news, and I speak as someone who both produces and consumes it, it's going to drive you insane.
Yeah.
And I lament that about my business, that we are in the business of making you angry and afraid. I hate that, but that is the fact of our business. And cable news, specifically, it's not the job of a print journalist. Because the temperature when you're reading a long-form piece, stays pretty, it's really different than it is watching someone yell it on your screen about this and that and this, and then now we're on to the next. And it's frenetic. That's a diet. That should be a very small part of your diet. Your news consumption diet is cable news. Again, I say that as someone who makes my money there, but like it should be a very small. And we repeat every hour. Yeah. Like we're repeating stories constantly. Yeah. So like turn it on in the morning, figure out what's going on, and maybe a little bit at night, little bit, and that's it. I used to have it on all day, all night. I'd fall asleep to it. I'd wake up to it on the train, wherever I was. It was constant. And that was both unnecessary and unhealthy. So get the news, be informed, but go intentionally onto social media and on your news sites with intention. I'm here for 5 minutes. I'm here for more on this story or policy. And then I'm leaving and I'm going on with my day.
Yeah, not get consumed by it.
You can't.
Such great advice. Essie, thank you so much for all you do.
Pleasure.
And
thanks for having me.
I've learned so much from you.
Oh, same.
Just in this process. So thank you for being here with us today.
My pleasure. Thanks for doing these conversations. It's great.